On October 16, 1846, a dentist named William Morton stood in front of a crowd at Massachusetts General Hospital and did something no one had done successfully before. He put a patient into sleep, cut into him, and woke him back up feeling nothing. The room called it a miracle. Surgeons before that day operated on fully conscious patients, held down by assistants, screaming through procedure that took minutes to feel like hours. Anesthesia ended that. It arguably one of the greatest medical inventions in human history. And it can still, under the right circumstances, kill the person it's supposed to be protecting. Not because doctors are careless, because of what anesthesia actually does to your body and how thin the margin is between asleep and gone. Here's what most people think anesthesia does. It makes you unconscious. That's it. But that's not it. Unconsciousness is almost the easy part. The dangerous part is what happens to everything else while your brain is switched off, because your body doesn't pause just because you are not aware of it. Start with the breathing. Under general anesthesia, your body loses the automatic drive to breathe on its own. The drug suppresses the brainstem region that controls respiration, which is exactly why you are intubated during major surgery. A machine breathes for you because your body has to, for all the functional purposes. If that airway is placed even slightly wrong, or if it fails, oxygen stops reaching your brain within minutes. Anesthesiologists call this the golden window, and it is shockingly short. 4 minutes without oxygen and you are looking at potential brain damage, which can make your condition significantly worse. The entire job of the person monitoring you during the surgery is to make sure that that window never opens in the first place. Then there is your heart. Anesthetic drugs don't just quiet your brain, they interact directly with your cardiovascular system. And in some people, that interaction goes wrong in ways that have nothing to do with skill or dosage. There is a condition called malignant hyperthermia, and it is one of the strangest reactions in modern medicine. In people with a specific genetic mutation, certain anesthetic gases trigger a runaway chain reaction inside muscle cells. Calcium floods the cell uncontrollably. Muscles locked rigid. Body temperatures can spike past 105 degrees Fahrenheit in minutes. And without immediate treatment, it can be life-threatening. The unsettling part is that most people carrying this mutation have no idea until the moment they are on the table and the reaction starts. There is no symptom beforehand and no warning sign. The first time your body tells you is the worst possible time to find out. This is why anesthesiologists ask about family history before surgery. Not because they are being thorough for the sake of paperwork, but because a parent or sibling with an unexplained reaction under anesthesia is sometimes the only clue that this mutation runs in your bloodline at all. And then there is a part almost nobody talks about, because it doesn't kill you, it just haunts you. Anesthesia awareness. This is when the paralytic drugs work exactly as intended. Your muscles are locked, you cannot move, cannot speak, cannot signal distress in any way. But the sedative component doesn't fully take. You are conscious. Sometimes you can feel pain and you are completely unable to tell anyone. It is estimated to happen in somewhere around 1 or 2 out of every 1,000 surgeries under general anesthesia. More often in emergency trauma cases or cardiac surgery where doctors intentionally uses lighter sedation because deeper anesthesia is too risky for an already unstable heart. Patients who experience this often describe it using the language of trauma survivors because that's functionally what it is. So why does any of this happen if we have had 180 years to perfect it? Because anesthesia isn't just one drug. It is a cocktail, usually 3 to 5 different agents, each doing a separate job. One removes the consciousness, one blocks the pain signals, one paralyzes the muscles so your body doesn't move during the surgery. One controls your blood pressure, and every single one of those drugs interacts with your unique physiology, your genetics, your organ function, your weight, your other medications in ways that can't be perfectly predicted in advance. Anesthesiologists are not just administering drugs, they're running a live experiment on your specific body, adjusting in real time based on your heart rate, oxygen saturation, and blood pressure, sometimes every few seconds. This is also why the pre-surgery questionnaire matters more than most patients realize. Every question about allergies, past reactions, family history, even how much you drink is a data point used to reduce a risk that can't be reduced to zero. Liver function determines how fast you metabolize the drugs. Kidney function determines how they are cleared. Even body fat percentage changes how anesthetic distributes because some agents are fat soluble and linger far longer in someone with higher body fat than someone without. Here's the number that actually matters. And it's a number that should reframe everything you just heard. In healthy patients undergoing routine surgery today, anesthesia related mortality is somewhere around 1 in 100,000 to 200,000. To put that in perspective, that's similar order of magnitude to your lifetime odds of being struck by lightning. The catastrophic scenarios like malignant hyperthermia, airway failure, awareness under paralysis are real, documented, and terrifying when they happen. They are also because of exactly how much monitoring and protocol exists today. The risk hasn't just disappeared. It has been compressed into an incredibly narrow band of decades of refinement, decades of exactly the kind of failures we just walked through being studied, understood, and engineered against. Which is the part that makes the whole story strange rather than simply frightening. Anesthesia is the safest right now, this year than at any point in its 180-year history, and it is safest specifically because of every death and every close call that came before it. Every cases of malignant hypothermia that ended badly is why hospitals now stock dantrolene, the drug that reverses it, in every operating room. Every airway failure is why intubation protocols exist. Every reported cases of awareness is why monitoring technology now tracks brain activity in real time during your surgery, not just your heart rate and oxygen. So the next time you're lying on a table, counting backward from 10 and you don't make it to 2, understand what's actually happening. You're not just falling asleep. Your breathing is being taken over by a machine. Your heart is being watched by someone whose entire job for the next several hours is making sure it doesn't do anything it is not supposed to. And you're trusting an entire system built from a century and a half of exactly the failures we just talked about to make sure yours isn't next. And it usually works. It worked for 180 years, but it works because somewhere in that history it didn't, and someone made sure it wouldn't happen the same way twice.